I travel a lot and I see a lot, but it took me by surprise to learn in an area of Ethiopia, parents delay picking the names for their new babies by a month or more. Why delay? Why not take advantage of this special ceremonial time? Well, they delay because they're afraid. They're afraid their baby will die. How can it be that 2.6 million babies die around the world before they're even 1 month old? 2.6 million. That's the population of Vancouver.
When I take you into my bubble graphs, still here, child death per 1,000 on that axis. Here we have year. And I'm now giving you a wider picture than the MDG. I start 50 years ago when Africa celebrated independence in most countries. I give you Congo, which was high, Ghana lower, and Kenya even lower. And what has happened over the years since then? Here we go. You can see with independence, literacy improved, and vaccination started, smallpox was eradicated, hygiene was improved, and things got better. But then in the 80s, watch out here, Congo got into civil war, and they leveled off here. Ghana got very fast. This was the backlash in Kenya, and Ghana bypassed, but then Kenya and Ghana go down together, still a standstill in Congo. That's where we are today. So let me show the wider picture. My country, Sweden, 1800, we were up there. And then you see these were famine years, these were bad years, and people got fed up with Sweden. My ancestors moved to the United States, and eventually soon they started to get better and better here. And here we got better education and we got health service and child mortality came down. We never had a war. Sweden was in peace all this time. But look, the rate of lowering in Sweden was not fast. Sweden achieved a low child mortality because we started early. We had primary school actually starting in 1842. And then you get that wonderful effect when we got female literacy 1 generation later. You have to realize that the investments we do in progress are long-term investments. It's not about just 5 years. It's long-term investments. And Sweden never reached Millennium Development Goal rate, 3.1% when I calculate. So we are off track. That's what Sweden is. But we don't talk about it so much. We want others to be better than we were. And indeed, others have been better. Let me show you Thailand. See what the success story in Thailand from the 1960s, how they went down here and reached almost the same child mortality levels as Sweden. And I'll give you another story. Egypt, the most hidden, glorious success in public health. Egypt was up here in 1960, higher than Congo. The Nile Delta was a misery for children with diarrheal disease, and malaria and a lot of problems. And then they got the Aswan Dam, they got electricity in the homes, they increased education, and they got primary health care, and down they went, and they got safer water, they eradicated malaria, and isn't it a success story?
And I'm going to talk about HIV today, about the deaths, about the stigma. It's a medical story, but more than that, it's a social story. This map depicts the global distribution of HIV, and as you can see, Africa has a disproportionate share of the infection. There are 33 million people living with HIV in the world today. Of these, 2/3, 22 million, are living in sub-Saharan Africa. There are 1.4 million pregnant women in low and middle income countries living with HIV, and of these, 90% are in sub-Saharan Africa.
AIDS was discovered 1981, the virus 1983. These Gapminder bubbles show you how the spread of the virus was 1983 in the world, or how we estimate that it was. What we are showing here is on this axis here, I'm showing percent infected adults, and on this axis I'm showing dollar per person in income. And the size of these bubbles, the size of the bubbles here, that shows how many are infected in each country, and the color is the continent. Now you can see United States, 1983, had a very low percentage infected, but due to the big population, still a sizable bubble. There were quite many people infected in the United States. And up there you see Uganda. They had almost 5% infected, and quite a big bubble in spite of being a small country then. And they were probably the most infected country in the world. Now, what has happened? Now you have understood the graph. And now, in the next 60 seconds, we will play the HIV epidemic in the world. First, we had a fast rise in Uganda and Zimbabwe. They went upwards like this. In Asia, the first country to be heavily infected was Thailand. They reached 1 to 2%. And then Uganda started to turn back, where Zimbabwe skyrocketed. And some years later, South Africa had a terrible rise of HIV frequency. Look, India got many infected, but had a low level, you know. And almost the same happens here. See Uganda coming down, Zimbabwe coming down, Russia went to 1%. In the last 2 to 3 years, we have reached a steady state of the HIV epidemic in the world. 25 years it took. But steady state doesn't mean that things are getting better. It's just that they have stopped getting worse. But focus now is back on prevention. That's only by stopping the transmission that the world will be able to deal with it. Drugs is too costly. Had we had a vaccine, or when we will get the vaccine, that's something more effective. But the drugs are very costly for the poor. Not the drug in itself, but the treatment and the care which is needed around it. So, when we look at the pattern, one thing comes out very clearly. You see the blue bubbles, and people say HIV is very high in Africa. I would say HIV is very different in Africa. You have the highest HIV rates in the world you find in African countries, and yet you find Senegal down here the same rate as United States. And you find Madagascar, and you find a lot of African countries about as low as the rest of the world. It's this terrible simplification that there is one Africa and things go on in one way in Africa. We have to stop that. It's not respectful and it's not very clever to think that way.
Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. The best lessons, I think, on how to get prepared are, again, what we do for war. For soldiers, we have full-time, waiting to go. We have reserves that can scale us up to large numbers. NATO has a mobile unit that can deploy very rapidly. NATO does a lot of war games to check, are people well-trained? Do they understand about fuel and logistics and the same radio frequencies? So they are absolutely ready to go. So those are the kinds of things we need to deal with an epidemic. What are the key pieces? First is we need strong health systems in poor countries. That's where mothers can give birth safely, kids can get all their vaccines, but also where we'll see the outbreak very early on. We need a medical reserve corps. Lots of people who've got the training and background who are ready to go with the expertise. And then we need to pair those medical people with the military, taking advantage of the military's ability to move fast, do logistics, and secure areas. We need to do simulations, germ games, not war games, so that we see where the holes are. The last time a germ game was done in the United States was back in 2001, and it didn't go so well. So far, the score is germs 1, people 0. Finally, we need lots of advanced R&D in areas of vaccines and diagnostics. There are some big breakthroughs, like adeno-associated virus, that could work very, very quickly. Now, I don't have an exact budget for what this would cost, but I'm quite sure it's very modest compared to the potential harm. The World Bank estimates that if we have a worldwide flu epidemic, global wealth will go down by over $3 trillion. And we'd have millions and millions of deaths. These investments offer significant benefits beyond just being ready for the epidemic. The primary health care, the R&D, those things would reduce global health equity and make the world more just as well as more safe. So I think this should absolutely be a priority. There's no need to panic. We don't have to hoard cans of spaghetti or go down into the basement. But we need to get going because time is not on our side.
And the question I would get asked over and over again is, what is the greatest risk factor for your health? And I would say loneliness. We are tribal beings. We are supposed to be together, and our nervous systems are wired that way. So when we feel socially isolated, then the nervous system goes into threat. And the limbic brain, the survival part of the brain, the really primordial brain, starts to freak out. It goes into the sympathetic nervous system, or what Walter Cannon at Harvard called the stress response. You may know it as the fight or flight response. And when the nervous system is in fight or flight response, the body fills with cortisol and epinephrine. These hormones put us at risk of heart disease and every other kind of illness. And we know that the body is beautifully equipped with natural self-healing mechanisms. We make cancer cells every day. We fight our own heart disease every day. We have natural longevity enhancements built into our bodies. But here's the kicker. Those natural self-healing mechanisms only work when the nervous system is in what Herbert Benson at Harvard called the relaxation response. This is the parasympathetic nervous system. When we know that we belong, when we can feel ourselves in love, in community, in tribe, then the nervous system relaxes. But you think about the single mom who's by herself trying to raise 3 kids and get to her job, and the kids are sick and she doesn't have any help, and what about her social life, and what about her self-care? Her nervous system is in stress response all the time. And this puts her at risk of disease and decreases her longevity. And we Americans, we're only supposed to be in stress response when we're getting chased by a tiger. But evidence shows that we're in stress response more than 50 times per day, and lonely people are in stress response even more than that. So this is the part where I'm going to talk to your mind, in case you don't believe loneliness and health are related. Air pollution increases your mortality by 6%, obesity by 23%, alcohol abuse by 37%, loneliness by 45%. Loneliness is as dangerous for your health as smoking 15 cigarettes per day. There was a study in Alameda County that showed that people with the fewest social ties were 3 times more likely to have died over a 9-year period. There was another study in UCSF of 3,000 women with breast cancer that showed that people who go through their cancer journey alone are 4 times more likely to die from their disease than those who have 10 or more friends. Lonely people have higher rates of heart disease, cancer, dementia, high blood pressure, diabetes, infection, anxiety, depression, insomnia, suicide, and alcoholism, addictions. There was one great study done by Harvard where they followed 700 men over 75 years to look at wellness and well-being in general. And Robert Waldinger, one of the researchers, said over and over these 75 years, our study has shown that the people who fared the best were the people who leaned in to relationships with family, with friends, with community. But 1 in 5 Americans is lonely. This is 60 million people. This is a massive public health epidemic. But when was the last time your doctor prescribed healing your loneliness as part of your wellness plan or as part of a healing journey?